Good. Thank you, Dr. Deb. Morning, everyone. So far this morning, we have some wonderful presentation. I'm really enjoying the symposium. Well, after being through Zoom for more than a year now, you thought like after doing that, like, oh man, another Zoom thing. But, I miss out on the quiz thing because my daughter came in at the middle of the quiz and I need to go out to help her. So, yeah, anyway, Ross, you didn't have a perfect competition next time. Anyway, I'm going to give you a quick summary of what the project I'm working on and what I've done so far last 8 or 9 months now. The area that I'm working as a CADS fellow is mobile crowd sensing. My focus in this research area is data redundancy, and my application area is indoor localization. So I will explain those as I progress along. So basically, that's sort of like the overall summary of the project, what we are trying to achieve, what we are trying to attack in this particular project. So you guys all know about mobile crowd sensing. We all carry a really powerful device with us all the time that has a bunch of different sensors, and we put our life in it. We can sense really useful data out of that to do different useful operations. Now, definitely, I'm not doing any hacking or anything. It's have to be volunteered data. That means the user is volunteering to share the data. But we can collect those data and do. There are a lot of potential, a lot of use cases of that. One that we are addressing in this research is facility management, and I will discuss that a little bit later. Now, as with crowd sensing, one of the biggest challenge is the amount of data that the crowd sensing devices collect. Like your mobile device always collecting data, sharing it in the cloud, putting it in the cloud. So one aspect of this research is how can we minimize that collection and redundant data. So along with that, this research, we are planning to do a couple of other implementation challenges. So let's go into detail what we've done so far. So when we started, our overall goal was to attack facility management, but we didn't have an exact application area. So thanks to the director of CADS and some very energetic faculty from the health sciences, we forged a really nice collaboration, and the Forsyth County Community Care Clinic with them. And they have student practitioners who help the clinicians, the doctors, the faculty over there with patient services. So how we can use that mobile crowd sensing to actually improve improve and enhance basically those student practitioners, whatever they are providing their services, and how they're also learning along the way how can we improve them. One other aspect is when they're providing all those services to the patient, how can we improve the ergonomics and the safety? Okay. So we have a bunch of goals. So part of there is no such exactly no such work has been done that attack the same particular application area. We have certain novel differences. But one of the things we are trying to achieve is, although it was there before with all the mobile devices, it's called proximity detection. Before COVID hit, people were not normally using it other than theoretical purposes. There was no application of that. So like contact tracing, whenever you are walking with your phone, it can sense what other phones are near to that particular phone. So we want to create sort of like a contact tracing protocol that we can use for that particular application area. And then develop an crowd sensing application for that facility management. And we also want to provide the clinicians and the faculty with a easy to use visualization and interface kind of thing. And eventually the collection of data, we want to do all the data analytics and big data processing on that to improve the facility management and student learning. So quickly, a couple of differences that I can share with this work is normally, so the idea is every device will sense what other device next to it, and then it will monitor the movement of that device. So if you have devices which are stationary, they can sense which other devices are moving close to them. And they can then collaboratively share that data. So all the stationary devices which are placed in a strategic place, like close to a device that a particular device that the students are using, or some patient services, some specific room, those devices can collaboratively share those data between them and figure out which way that particular student is moving, or that particular device is particularly moving. From that, so we use a received signal strength indicator. That's the bar that you see in your phone. You say 3 bar, I have 3 bars and stuff like that. So we are using Bluetooth, nothing else. Bluetooth is by default every device. Now, what is the one big difference of similar system is they either use Wi-Fi or Internet of Things, a specific hardware device. We don't want to use that because that's not more practical in a clinical situation. Instead, we can use actually the doctors or the faculty's devices, mobile devices, to actually get those proximity, and then we can triangulate and trilaterate and do all of that to figure out which way that particular device is moving. We also can get some, using the accelerometer and other devices, we can get some contextualized information, like how the student is providing support, or how fast maybe, is there any fall, sudden lose of balance because they're running probably to get something from the supply room or something like that. So we can also use that to contextualize the data. And the plan is to do device to device crowd sensing. So those stationary devices will actually talk to each other and reduce the data, and don't send all the data back into cloud, but they will say which one is repeated, and they try to sort of like pre-process the data before it sends to the cloud. So that way we can also address that data redundancy. So normally on the left you see how we are envisioning how the app will sense the movement, like the a particular student practitioner is moving from one location to another location, and then on the right it's showing at the end of the day, probably it's a sort of like a summative way of saying which paths have been most frequently traveled. So we know exactly that practitioners are using going from this location to that location more, and we should make them closer, or make them more easily accessible. And you see the crosses, that means we sense that there are some sudden lose of balance or something. So that means there might be a furniture that they tipped over or something, and we need to maybe change the layout of the clinic or something. So this kind of thing we can generate, and we can produce other kind of visualization from the data collected. So
Dr. Fuad, you have 30 seconds left. I'm sorry.
Really?
Yes.
I was fast, but anyway, we as I mentioned, we are using only Wi-Fi. We are only using Bluetooth, no specialized, so that we can use any other device. We've been doing some background work to figure out the capability of Bluetooth and how accurate that is, and that's in line with our goal. So we developed a couple of mobile apps to do all those basic stuff. The student who is working as part of this project has presented in the scholarship day. We submitted a paper. It's now being we are doing revision for resubmission, and we submitted a proposal to NSF with Dr. Nancy Smith and Dr. Tiffany Adams from the Department of Physical Therapy, and also with Dr. Deb as co-PI.